Hello, it's Dr. Rhonda Johnson. Today is Saturday, July 24th, 2021. And today I'm going to be talking about the COVID infection rates are on the rise again. And I'm going to be talking about monoclonal antibody treatment. But first, COVID infections are on the rise here and worldwide. The Institute for Health Metrics, an independent population health research center at the University of Washington, released updated projections yesterday, and their projections now show that worldwide 4.93 million people have died from COVID-19, and they project, listen to this, in excess of 10.78 million deaths globally through November 1st. And again, the pandemic at this point is being driven by the spread of the Delta variant worldwide, which is causing 7 million infections daily, according to the Institute for Health Metrics and Evaluation. 7 million a day from this Delta variant. Now, here in the United States, the CDC said the cases are up by 70% in just a week nationally. Hospitalizations have risen by 36% nationally. Folks, this is nothing to dismiss. Now, these national statistics are one thing, but what matters, of course, is where you live and what's going on with the Delta variant. And folks, if you live in a Delta variant hotspot, you already know it. It's on the news, and you need to act as soon as possible to get vaccinated if you aren't vaccinated. Now, in Massachusetts, this is a state that counts breakthrough cases, and those are cases among the fully vaccinated. They have confirmed 4,450 people in a very short period of time. Although that's 0.1% of all vaccinated people, my point is that everybody needs to worry about the Delta variant. It is not just a pandemic among the unvaccinated. Vaccinated people are at risk too. You know, we go to many public places, some of us, and you find nowadays most of the people are not wearing masks. So it's impossible to know who's vaccinated or who's not vaccinated. But one thing you can be sure of, since we know that nationally only 48% of eligible adults are vaccinated, all these folks who are walking around without a mask, folks, they cannot all be vaccinated. And they're not following the indoor masking guidelines for unvaccinated people. So, you know, I've said this before, even as a fully vaccinated person, I know the experts say I'm not likely to get seriously ill, but I do know that if I am exposed, I can get infected and pass it on to others, and that I may experience some degree of sickness that can range from a mild cold to the hospital, or I could get up in the hospital or seriously ill. There's no way to tell. So this is why I'm talking about monoclonal antibodies. I'm going to switch the topic a little bit to monoclonal antibodies. Folks, this is the life-saving COVID-19 treatment that everybody should know about. I will repeat, it's called monoclonal antibodies. And if you have tested positive for COVID, and if you are at high risk for developing a severe case of COVID, a treatment called monoclonal antibodies could be right for you. It helps stop the virus from multiplying in your body. Now, folks, what is it? It's synthetic copies. That means it was made in a lab of human antibodies. You know, that's kind of similar to how these COVID messenger RNA vaccines are made in a lab. But it gives your immune system a boost to help keep you alive. They will bind up to the COVID virus's spike protein to help neutralize the virus in the blood and help fight off infections. Now, this is not a vaccine. It's an IV treatment. It takes 25 to 30 minutes to give. It has to be given in the emergency room. They watch you for about an hour to make sure that you don't develop an allergic reaction. It provides immediate short-term immunity from COVID-19. and it will be very helpful. It's been very helpful in reducing rates of hospitalization and deaths, and it can save a lot of lives. So again, who's eligible for monoclonal antibody therapy? First, you have to test positive for COVID. You have to be having mild to moderate COVID-19 symptoms for 10 days or less. You will not get this if it's been more than 10 days because the virus has already replicated in your body and it's too late. You have to be 65 years of age or older, or you can be at anyone who is pregnant, or you can be 12 years and up if you have certain high-risk conditions. Now, if you've already progressed to severe illness, meaning you need oxygen or you have to be admitted to the hospital, the monoclonal antibodies can't help you. So folks, it's very important to get the COVID diagnosis, get the test, talk to your doctor, see a doctor. If you're feeling bad with COVID, get to the emergency room. And if they don't offer you monoclonal bodies, ask for it. Ask for monoclonal antibodies. So now, who are the high-risk conditions? You know, again, anybody ages 12 and older who have diabetes, chronic kidney disease, any type of disease that weakens the immune system, congenital heart disease or high blood pressure or heart disease, moderate to severe asthma, sickle cell disease. And again, there's a whole lot of people. I can't name everybody, but go to the doctor. People who have depended on medical technology, such as a feeding tube or anything that you need to assist with breathing. Again, this list is not complete. Monoclonal antibodies work right away, and people generally start to feel better within hours after they get this infusion. So the sooner you get it, the more effective it will be. They are safe. They've been approved by the FDA. They've been around to treat a whole lot of diseases and conditions for more than 10 years. Now, lastly, you have to wait 90 days after you have monoclonal antibodies to get the COVID vaccine if you're not vaccinated. And even if you're fully vaccinated, and they say we need a booster, if you've gotten monoclonal antibody treatments for COVID, you'll need to wait 90 days for your booster shot. So folks, that's the message today. Again, you need to know about this. It's going to be impossible almost to escape this Delta variant, but we're not throwing in the towel. We're not waving the white flag of surrender to Delta variant, any COVID variant, or any type of COVID infection. Remember this, the life that you save might be your own. Pass this message on to others. As always, my views are my own. My only goal is to help prevent another COVID infection. The best COVID infection is the one we don't get. Stay safe and have a blessed day.